3 hours of therapy. Many do more than 3 hours of therapy a day, 5 days a week. And everyone kind of gets a little nervous by that at first, but we're able to modify schedules and work patients through that to build them up to that level. Our primary goal is to increase function and independence and to allow a return to home. Length of stays will vary on diagnosis, but are typically anywhere from 10 to 28 days. And the most common diagnoses that we see are fractures, multiple trauma, stroke, multiple sclerosis, Parkinson's, traumatic brain injury, but there's really just a whole lot of things that we can help with. And that's my section.
All right, my name is Cory Wetzel. I graduated from Winona State University with a bachelor's in kinesiology with an emphasis on athletic training. Graduated back in 2006, and I've been here ever since. I'm going to talk to you about roles of athletic trainers today. One of our main responsibilities is our athletic training outreach program, which we cover 14 area high schools and colleges. There's quite a few to list. Don't want to forget anybody, so if you have questions with whatever schools that we're at, we can always get you that information later. But anywhere that Agnesian HealthCare is at, we more than likely will cover the high school or college. So, out there at the schools, we're working with those athletes. About 95% of our patients that we see and work with are about 14, 15 years old up to the college age athlete who 23, 24, 25 years old. When we're out there, we're doing initial musculoskeletal assessments, concussion assessments, working with rehab with those individuals, doing any treatments that we need to do. So I don't want to, we're not a physical therapist, however we do a lot of the same things that physical therapy does offer for those individuals that are in the clinic. We're just taking those services out to the schools and be able to treat those individuals out at the school without them coming in to see a physical therapist for those issues. We also have an athletic trainer out at Camelot Drive who is involved with our work hardening, work conditioning program. And basically what that is when an individual goes and sees physical therapy for a certain condition, say a shoulder or a knee, that physical therapist works with them. When they get to the point that they're ready to be discharged from physical therapy, meaning that physical therapy can't really offer a whole lot more for that individual, and they're a good candidate for work hardening conditioning. What we do in work hardening conditioning is get that individual ready to be able to take on the demands of going back to work for an extended period of time, for an 8-hour day or 6-hour day or 10-hour day or whatever that is. So we do that as well. Work steps, we also, we have this available at Camelot Drive and then also out at Ripon Medical Center. What that is like a pre-employment screen for employers. They'll send individuals who they're looking at hiring. We'll take them through, it's a work steps assessment, essentially seeing how much can they lift, can they safely do it when they're trying to perform the lift, and then we send that assessment back to the employer, and then they make their decision based on whatever our assessment is. Impact testing in our concussion clinic, we work with here at the hospital, family medicine and pediatrics. We also have physicians down in Mayville, Waupun, and then Ripon as well. What impact testing is a neurocognitive test on the computer that allows us to see how the brain is processing information. It lets us know if there's any deficiencies. Typically with any impact test, it's ideal to have, we call it a baseline test, so a test before an athlete does get a concussion, and then we can compare their post-injury test to their baseline test and see if there's any deficiencies that way. When an individual has a concussion, now I keep on referencing athlete, that's our primary caseload, obviously, so that's ingrained in my head, athlete, athlete, athlete. We do see those individuals, patients that are, adults, 20, 30, 40, 50-year-old individuals who do get a concussion. We know that concussions aren't exclusive to athletics. You can slip in the winter on some ice, fall and hit your head, have all these headache, dizziness, concussion-like symptoms, go to the doctor. We have a program now. We can send them to a physician that's trained in dealing with concussions and get them the care that we need now. And then lastly, our SPEED program is just a sports performance enhancement program for our local area high school athletes. And that's just, we're trying to increase one's athletic performance, increasing the 40-time vertical jump, things like that. So we work with those kids primarily over the summer for about 8 weeks. We do offer individual stuff throughout the school year as well if we have interest. But that is about athletic training, our SPEED program in a nutshell. With that, I believe if anybody has any questions, we're turning it over to you guys.
Just from a time perspective, it is, if someone has 9, if you have to go, it's 9 o'clock, but we're here and available if you have questions for anything that was spoke about today. Yeah, Joyce.
Do you need a doctor's order to get TMJ services? Or?
So basically with our insurance plan, yes. In the state of Wisconsin, you don't need a referral for physical therapy for most things, but most insurance companies require a referral. So resident right now, yes, if you have the Cisco plan, you do.
That referral could be from a dentist?
Yeah, it could be from a dentist as well. Any other questions? Okay. Katie's getting the goodie.
Do I have everyone's? Okay, I'll let you pick.
All right, while you read it.
Oh, Zach Pitts.
Maria
Mecki.
Maria Mecki, sorry, I couldn't read, sorry. Maria Mecki.
Okay,
What's she
thank
with?
you. She has a rolly bag up here.
Awesome. Thank you, everyone. I think I'll just go through it. Just do it basically just on the slide which I'm there. That we can Good job. Thank you. You all did really well.
Oh, I see.
You said you were nervous.
You did well. I think I looked at my slide and got very good language.
Yeah, you know yourself.
It was a little quiet.
That's what the other day I was thinking, I'm like, I haven't really gotten back to Sarah to see where it was at.
Yeah, there were a few takers, but worst case scenario, all 10
Oh, okay.
Yeah, just don't know about whether-
Thanks.
We can do it. Yeah, we can do it.
Thanks, Zach.
Sounds good, thank you. I'll let her know. All right.
It's an interesting time. Last semester was amazing.
I should have made it good. I didn't Yeah, it's different. I'll take that out. Then when I speak with this
Katie.
Okay, that's what I got to bring up, but I was like, double
When the speech
I did
therapists do the
mention
video
it to him, like,
Yeah.
if you want to say, they usually make a recommendation for
diet consistency.
Yep.
And then it's a whole.
Just saying, just telling ya.
Has to be
Okay, I-
they can't put, they can put the order in for consistency to send.
Who's they?
Speech
Okay,
therapist. They can put
Yeah,
the
so we just want to do
consistency
that
order
Friday.
in, but then when that goes to dietary, it doesn't have attached.
So when should we
you
go
know,
there?
diet stuff with it, so if you're on a low sodium, cardiac, whatever. So Vicky's question is correct, we have in TCU, can we do
That's what we were doing.
that the nurses can put that in, because it's within the nurses scope, based on the recommendation. I mean, and then Vicky goes, well, if we have in TCU, why don't we do it across the board?
You get started there.
Because the problem is that when they do the video, and they have the patients as well, I don't know, it looks like you're safe, it's basically it's an upgrade in there, they want to keep.
No,
So
yeah.
that way is a dissatisfied.
So what's happening, you're gonna try it with one first,
One
or?
week with Vicky this morning. And I asked Carrie yesterday, like,
Can you stand up there a second?
I have to go to,
together, and
Just a
I have to
second.
go to a meeting though,
So do I, and I want to make sure this is fixed for noon.
for the hospital.
Sorry, do you want to
It's still crappy.
as it is, or?
Save as is, and then I'll be down, I'll make sure I'm here 10, 15 minutes early, because we're gonna take the whole vestibular part of it out, so we'll cut about 7, 8 minutes off the top, because she's not gonna be here at noon, so we're just gonna take that whole section out, then we'll be done for
Okay.
time. this
yeah, then
afternoon.
there could be, because people, there's probably some questions, but yeah.
When it's